If you've had a cesarean in the past, you may have been told or just assumed that all future births need to be by cesarean, but that's not always the case. Many women are candidates for VBAC, and for some, it can be a safe and empowering choice. That said, the decision to pursue a VBAC isn't always straightforward. It can bring up questions about safety, emotional readiness, and even fears stemming from previous birth experiences. This video is here to help you navigate those questions and make an informed decision that's right for you. We'll cover what a VBAC is, its benefits and risks, how to determine if you're a good candidate, and the steps you can take to prepare. By the end of this video, you'll have a solid foundation to explore whether VBAC might be an option for you. First, let's break down what a VBAC actually means. VBAC stands for Vaginal Birth After Cesarean. It refers to giving birth vaginally after having had one or more previous cesareans. Historically, it was common for doctors to recommend repeat cesareans for all subsequent births, but research over the past few decades has shown that a VBAC can be a safe and viable option for many women. It's also worth noting that VBAC doesn't mean going it alone or ignoring medical advice. It means working with your healthcare team to try for a vaginal birth while keeping the option for a cesarean open if complications arise. Why might someone consider a VBAC? There are both physical and emotional reasons. Physically, a vaginal birth often leads to a quicker recovery, less postpartum pain, and fewer complications compared to major abdominal surgery. Emotionally, a VBAC can provide a sense of empowerment and closure, especially for women who felt that their cesarean was unexpected or out of their control. About 60 to 80% of women who attempt a VBAC are successful, which shows that for most candidates, it's a very realistic option. Now, not everyone will be a candidate for a VBAC, but many women are, and the guidelines for eligibility might surprise you. Here are the main factors healthcare providers look at when determining whether a VBAC is safe for you. 1. The type of uterine incision. So the type of incision made during your previous cesareans plays a huge role. The most common type, called a low transverse incision, has a very low risk of complications during a VBAC. On the other hand, a vertical or classical incision, which is quite rare, may increase the risk of uterine rupture and might make VBAC less safe. 2. Reasons for your previous cesarean. If your previous cesarean was due to a one-time issue like a breech baby or placenta previa, you're more likely to be a good candidate for a VBAC. However, if the cesarean was due to ongoing issues such as a pelvis that's too narrow for delivery or complications during labour, your provider may recommend a repeat cesarean. 3. Overall health. Your current health and pregnancy play a role too. Conditions like gestational diabetes, preeclampsia, or placenta complications may influence the decision. 4. Number of previous cesareans. While VBAC is possible after multiple cesareans, the risks do increase slightly with each surgery. Some providers are comfortable supporting a VBAC after 2 or even 3 cesareans, while others may be more cautious. It's essential to have an open and honest conversation with your healthcare provider to understand your unique situation. There are several reasons why women choose to attempt a VBAC, and the benefits go beyond just the physical recovery. So 1, you do have a shorter recovery time. After a vaginal birth, you'll typically recover more quickly than after a cesarean. You'll likely be up and moving sooner with less pain, which can be especially helpful if you have older children to care for. 2. Lower risk of surgical complications. Avoiding another major surgery reduces the risk of issues like infections, blood clots, and anesthesia-related complications. 3. Future pregnancy benefits. The more cesareans you have, the higher the risks in future pregnancies. These include complications like placenta previa, where the placenta covers the cervix, or placenta accreta, where the placenta attaches too deeply to the uterine wall. VBAC can reduce these risks. 4. Emotional fulfillment. For some women, a vaginal birth can be a healing experience, especially if their previous cesareans were unplanned or felt traumatic. While VBAC is generally safe for many women, it's important to understand the risks involved. So one risk is a uterine rupture. This is the most significant risk associated with VBAC. It occurs when the scar from the previous cesarean tears during labour. While this sounds scary, it is very, very rare, occurring in less than 1% of VBAC attempts. When it does happen, medical teams are usually able to intervene quickly with a cesarean to keep both mother and baby safe. 2. Emergency cesarean. Even with the best preparation, about 20 to 40% of women attempting a VBAC will end up needing a cesarean during labour. Reasons might include labour not progressing, fetal distress, or other complications. And lastly, just like any vaginal delivery, VBAC comes with risks of tearing, bleeding, or interventions like forceps or vacuum assistance. It's important to weigh these risks against the risks of a repeat cesarean, which also includes surgical complications and longer recovery time. Preparation is one of the most important steps to increasing your chances of a successful VBAC. Here are a few key steps. Find a VBAC-friendly provider and facility. Not all healthcare providers or hospitals are supportive of a VBAC. Look for a provider who has had experience with VBAC and a hospital equipped to handle emergencies. Build a supportive birth team. A supportive team, including a midwife or doula, can make a big difference in helping you stay calm and confident during labour. Stay physically active. Strengthening your core and pelvic floor through prenatal fitness can prepare your body for labour. Exercises like walking, yoga and swimming are also excellent options. Educate yourself. The more you know, the more confident you'll feel. Take childbirth classes, research VBAC stories, and talk to other mums who've experienced it. The emotional side of a VBAC is just as important as the physical preparation. So address your fears. If you're nervous about complications or reliving a traumatic birth experience, consider talking to a therapist, counsellor, or doula. They can help you process those feelings and build confidence. Try positive affirmations. Using positive affirmations can help reinforce your trust in your body's ability to birth vaginally. If you have a successful VBAC, your recovery will likely be quicker than after cesarean. However, every birth is unique. So make sure you focus on gentle pelvic floor exercises to rebuild strength. I have a 12-week postnatal fitness course and I can guide you through this. Make sure you rest when possible and seek help with childcare and household tasks. Deciding to pursue a VBAC or opt for a repeat cesarean is a deeply personal choice, but with the right preparation and support, VBACs can be a safe and empowering option for many women. If this video helped you, don't forget to like, subscribe and share it with others who might benefit. And let me know in the comments, are you considering a VBAC or have you experienced it yourself? I would love to hear your stories. Thank you for watching the Mum Bod PT and I'll see you in the next video.